Okay, let's unpack this.
Yeah.
Healthcare. I mean, it's a system we all rely on, incredibly vital, but let's be honest, it faces these massive systemic challenges.
Hmm.
We're talking about stubbornly high costs, processes that can feel, well, anything but efficient, and critically, the devastating reality of preventable mistakes.
That's really the stark picture the source material paints right from the get-go. It
Yeah.
highlights the immense human cost, errors that just shouldn't happen.
Yeah.
And it puts a staggering financial figure on it, too.
Yeah.
Something like, what, $8.9 billion in the U.S. alone in 2010, all linked to preventable incidents. It's a problem that just screams for fundamental solutions.
Absolutely. And when you have a challenge this big coming at you from multiple angles like cost, efficiency, and safety, people start looking in, well, sometimes unexpected places for answers.
Right.
One approach that keeps popping up, maybe surprisingly since it comes from manufacturing, is lean thinking. In healthcare, you often hear it called health lean management, or HLM.
Well, what's fascinating here is seeing rigorous academic study applied to these ideas. Ideas from one sector being tested for impact in another sector as absolutely critical as healthcare.
Definitely.
At its heart, lean thinking is really about relentlessly focusing on what adds value for the customer, in this
Yeah.
case, the patient, and systematically stripping away everything else, everything that doesn't add value. It's about flow, reducing variation,
Yeah.
eliminating waste.
Right. And waste isn't just like physical garbage bags. It's wasted time, wasted movement, wasted supplies, unnecessary steps.
Exactly, all of that.
So the big question is, can these principles, honed in factories, actually move the needle on something as complex and high stakes as healthcare safety and efficiency?
Yeah.
That's exactly what this deep dive is all about. We're digging into a systematic literature review, basically, a high-level investigation of existing research that pulled together findings from 51 different papers, all specifically looking at how lean principles are being applied to risk management in healthcare organizations.
And the whole point of a systematic review like this is to cut through the noise, right?
Yeah.
Instead of looking at just one study here or there, it maps the entire landscape of research.
Wow.
It shows what the collective body of work tells us, what we actually know, and maybe even more importantly, what we don't know yet, what still needs figuring out.
Got it. So we're going to explore what the research reveals about applying lean in healthcare, zeroing in on this connection to managing risk and boosting safety for patients and staff.
Yeah, both are key.
We'll look at where it seems to be making a real difference, what kind of factors make or break its success, and what the big unanswered questions are. Let's get into it. So before we jump into the specific findings, maybe just a quick refresher on what lean actually looks like when you bring it into a hospital or clinic setting.
Sure. It's really about optimizing the processes. Think about how a patient moves to their care journey, how medications are handled, how procedures are set up and performed. Muli focuses on identifying what truly creates value for that patient in each step, and then aggressively finding and eliminating anything that doesn't. The waste.
And tying that to risk management is the critical link here, isn't it?
Absolutely crucial. Because healthcare risk isn't just, a direct clinical risk like a surgical complication. It's also operational risk, systemic risk.
How so?
Well, lean helps because it forces you to take this really granular look at processes. You start seeing where errors are likely to happen, where bottlenecks create delays that could cause harm, or where a lack of standardization leads to variation and mistakes.
Ah,
It's
yeah.
about building safety into the process design rather than just reacting after an error occurs.
And as the review points out, that safety focus isn't just on the patient anymore, which is obviously vital, but there's this growing recognition that employee safety is also fundamental.
Yes, absolutely. An environment that's unsafe or just inefficient for staff is inherently going to be riskier for patients too. Staff well-being, their efficiency, it's directly linked to the quality and safety of care they can deliver.
Makes total sense.
Yeah.
Okay, so how did the authors of this review actually, take the pulse of all the existing research out there? They did this systematic literature review. Sounds technical. What does that rigorous process actually involve?
Think of it like doing research on the research, but in a very scientific way. It's highly structured, very transparent, all designed to minimize bias.
So not just a quick Google search.
Definitely not. They used a major academic database, Scopus in this case, and had a really specific, detailed search strategy. They used keywords like lean, risk, but also a whole range of healthcare terms, healthcare, hospital, patient safety, you name it.
So casting a wide net initially to make sure they didn't miss anything important.
Exactly. Their first search brought back over 1,000 potential papers.
Wow.
But then came the hard part, the rigorous filtering, systematically reviewing titles, then abstracts, then the full papers, to make absolutely sure each one genuinely focused on lean and risk management in a healthcare context. That intense filtering process whittled the list down to the 51 core papers that form the basis of their detailed analysis. It means the insights we're discussing today are grounded in, a comprehensive look at the solid evidence that actually exists.
Got it. So they took this carefully curated collection of 51 studies and synthesized their findings. What did they discover? What are the major themes or I think they call them streams of research?
Right, streams. So what does this all mean? This review identified 5 key streams where the research connecting lean and risk management in healthcare settings seems to be concentrated.
5 distinct areas. Okay, let's tackle them one by one. What's the first stream? The one with the most research behind it.
So stream 1, and it's definitely the dominant one in the literature, is risk management specifically focused on patient safety. This is where the bulk of the research connecting lean and healthcare risk has really honed in. It looks at how applying lean principles to actual clinical processes directly impacts safety outcomes for patients.
Okay, patient safety first. Can you give us a sense of the types of improvements these studies actually documented? What did they achieve by using lean?
Yeah, the findings show some really tangible impacts. You see studies reporting things like reductions in patient waiting times or shorter hospital stays, which inherently lowers risks like hospital-acquired infections.
Makes sense. Less exposure time.
Exactly. More specifically, research has demonstrated significant drops in patient falls. One study they cited saw falls with injury drop by over a third after they implemented lean changes.
Wow, over a third reduction in falls with injury. That's a huge deal for patient well-being, obviously.
It really is. Other studies documented dramatic reductions in mortality rates for specific, quite complex procedures. In one case, looking at lung surgery, mortality dropped from over 3% down to less than 0.3% after a lean intervention focused on optimizing the surgical flow.
That's incredible.
And consistently, the research shows lean being used effectively to tackle medication errors, leading to measurable decreases in dispensing mistakes, missed doses, and just generally improving safe administration practices.
So it's hitting critical safety metrics directly: falls, mortality, medication errors. This isn't just theoretical stuff. The studies are showing concrete, positive results.
Exactly. The research in this stream really underscores that by focusing on process improvement, getting rid of that waste, you directly address common sources of patient harm.
Okay, patient safety is clearly paramount, but you mentioned employee safety is also in the mix now. Is that the second stream?
It is. Stream 2 focuses on risk management oriented towards employee safety. Now, the review notes this area has less published research compared to patient safety, but it's definitely gaining traction.
Okay.
The core idea is this growing recognition that the people delivering the care are absolutely critical resources, and their safety is essential, not just for their own well-being, but for the quality of care they can provide.
Right. And how does lean specifically help with staff safety? What's the connection?
Well, lean's emphasis on analyzing processes and eliminating waste ties directly into things like ergonomics and workplace design. The research suggests that poor work organization itself is a major source of occupational risk factors for staff.
Like musculoskeletal issues.
Exactly. Things like back injuries from awkward lifting, repetitive strain injuries, that sort of thing. By using lean to improve workflows and even the physical layout of workspaces, you can actually design out some of these hazards.
So making the process smoother and less wasteful also makes it physically safer for the person doing the job?
Precisely. Examples from the studies include things like reducing exposure risks for staff handling hazardous drugs, or implementing changes that led to a significant decrease in slips, trips, and falls among staff working out in the field. One study nearly halved the rate of those kinds of incidents.
If we connect this to the bigger picture, recognizing and addressing employee safety isn't just like a nice to have for staff morale or retention. It seems like a fundamental component of overall system reliability.
Absolutely.
And therefore, patient safety, too. A burnt out or injured workforce is just less effective and probably more prone to errors.
Exactly right. It's a totally interconnected ecosystem.
Okay. Now, Stream 3 feels a bit different. It's less about the direct clinical outcome or the physical environment and more about people, attitudes, and behaviors. How does that fit into lean and risk management?
Yeah, Stream 3 really hones in on the crucial importance of attitudes and behaviors for the success or failure of risk reduction projects using lean.
Yeah.
This is actually one of the review's most critical findings. The human element isn't secondary at all. It's absolutely fundamental.
Okay.
The research identified 4 key factors within this stream.
4 factors related to the people involved. Let's hear them.
Okay, first is teamwork. Healthcare is inherently multidisciplinary, right? You've got doctors, nurses, pharmacists, admin, support staff.
Everyone.
Lean relies heavily on collaboration across all those roles. But the research highlights a major challenge here: overcoming those traditional, often quite rigid hierarchical structures, especially things like physician autonomy and potential resistance to changes that might feel imposed from outside. Lean really requires breaking down those silos.
So getting everyone to genuinely collaborate, pushing past those old ways of working, that's a significant hurdle.
A very significant one, according to the studies. The second factor is training. The studies consistently emphasize that proper training is absolutely vital.
Not just on the lean tools themselves?
No, not just the tools. Training on teamwork skills, communication, specific safety practices related to the changes. One finding showed that something like 35% of potential process failures were linked directly to gaps in worker knowledge or skills. Without adequate training, lean efforts often just fizzle out or have limited impact.
Right. You need to equip the whole team so they even know how to spot risks and use these methods to fix them. Makes sense. What's the third factor?
The third is commitment. Lean isn't just a project or a quick fix. It needs to be seen and treated as a strategic, long-term organizational commitment.
Okay.
And the research clearly shows that resistance to change is a major barrier. Often it's driven by, a fear of losing control or just discomfort with the unfamiliar. Success really hinges on sustained, committed participation, especially from the frontline staff, the people who actually know the processes inside out. Some studies showed success was linked to engaging over 100 staff members directly in the improvement process.
So it can't just be a top-down order. It needs real buy-in and active involvement from the people doing the day-to-day work. And I guess that leads naturally to the fourth factor.
Exactly. Top management involvement. The review really highlights the critical role of leadership, and not just, giving a kickoff presentation about lean.
Right.
It means adopting a lean leadership style. That means managers actively facilitating the work, supporting frontline staff, actually going to where the work happens. They call it Gemba, providing the necessary resources. And critically, fostering a culture where continuous improvement and speaking up about risks are genuinely encouraged and rewarded.
Yeah.
Effective leadership communication is vital here. And interestingly, the source even points to research suggesting how leaders communicate their tone, their body language, can sometimes be even more impactful than the specific words they use.
That's fascinating. It's not just what they say, but the whole underlying message conveyed through their actions and demeanors. But I have to imagine changing that deeply ingrained organizational culture, especially navigating things like physician autonomy or just the sheer inertia of a large institution, that sounds incredibly difficult.
It is. It absolutely is. And the research confirms that. Trying to apply lean tools without genuinely tackling the organizational culture, especially fostering that leadership support and actively managing resistance, it's just unlikely to lead to sustainable risk reduction. The culture change is the deep, hard, necessary work.
Okay, so we've covered patient safety, employee safety, and this absolute necessity of addressing the human element, the culture, the teamwork, the leadership. Now, what about the specific methods, the actual tools lean uses? That must be stream 4.
Yeah, Stream 4 delves into the lean tools themselves as applied in healthcare risk management. The research identifies specific methodologies that teams are actually using on the ground to achieve these risk reduction goals.
Okay, what are some of the most common tools that kept showing up in these 51 studies?
Well, one really key tool is FMEA, which stands for Failure Mode and Effect Analysis. This is a proactive method. It helps teams systematically identify potential failures or risks within a process before they actually happen.
How does it work?
You basically analyze each step, brainstorm everything that could possibly go wrong, and then you try to quantify the potential risk. You look at how likely it is to occur, how severe the consequences would be if it did, and how easily you could detect it beforehand. It's been used in studies, for example, to prevent medication errors or improve the safety protocols around blood transfusions.
Okay, so FMEA is about anticipating where things could go wrong and prioritizing those risks.
Exactly. Then there's the Ishikawa diagram, also known as the cause and effect diagram, or often called the fishbone diagram because of its shape.
Right, I've seen those.
This one is typically used retrospectively, so after an incident or error has occurred, to systematically figure out the root causes. It helps teams brainstorm potential contributing factors by categorizing them, maybe under headings like materials, methods or processes, people or staff, management, environment. It's been applied, for instance, to uncover why healthcare-associated infections might be happening in a particular unit.
Okay, so FMEA for preventing, Ishikawa for investigating root causes. What else is in the toolbox?
DMAIC is a big one. Define, measure, analyze, improve, control. This is a very structured, data-driven improvement cycle. It's often linked closely with Six Sigma, but it's widely used in lean contexts too.
What does it do?
It essentially provides a step-by-step roadmap for tackling a specific problem. You define the problem, measure the current performance, analyze the causes, implement solutions to improve it, and then put controls in place to make sure the gains stick. Studies have used DMAIC successfully for things like reducing pressure ulcers or, again, preventing medication errors.
A really systematic approach to fixing a defined problem. And you mentioned VSM earlier, value stream mapping.
Yes, VSM is a powerful visual tool. Teams literally map out the entire process, step by step, usually from the patient's perspective.
Like a flowchart.
Sort of, but more focused on value. It allows them to see the entire flow, identify every single activity, and critically differentiate between steps that truly add value for the patient versus those that are pure waste things, like waiting, unnecessary movement, rework, duplication. By visualizing the current state, warts and all, they can then collaboratively design a much leaner, more efficient, and less risky future state.
Yeah.
It's been applied really effectively in surgery, for example, to reduce the time between the patient entering the OR and the first incision, which is a critical safety window.
Right, actually seeing the whole patient journey to spot the bottlenecks and risks. Any other key tools worth mentioning?
Well, brainstorming is pretty fundamental and used throughout, often in conjunction with other tools like Ishikawa or DMAIC, just for generating a wide range of ideas. And then there's 5S, sort, set in order, shine or clean, standardize, and sustain or discipline.
5S, okay.
This focuses on creating a clean, organized, and standardized workplace. It might seem basic, sorting out unnecessary items, having a designated place for everything, keeping things clean, standardizing procedures, and maintaining discipline. But it has a direct impact on safety and efficiency. It reduces clutter, ensures tools and supplies are where they should be, minimizes search time, and promotes a more disciplined approach overall. One study used 5S to reorganize medication storage areas, which led to a significant reduction in the quantity of high-risk drugs being stored unnecessarily on the unit.
So as you can see, these tools aren't just abstract concepts. They provide healthcare teams with really concrete methods to put the lean philosophy into practice, giving them structured frameworks to identify, analyze, and systematically tackle risks.
Yeah, they provide the practical how-to for implementing process improvement, specifically aimed at enhancing safety.
And the final stream, number 5, what was that about?
Stream 5 looks at the integration of different approaches. The research indicates that lean isn't always, or even usually, applied in total isolation. There's a trend towards combining lean with other established management systems or quality improvement methodologies, potentially leading to even greater, more holistic impact.
Like combining lean with, say, traditional clinical risk management practices.
Exactly. The review discusses studies looking at what they call lean and safety LNS projects. This approach combines lean strengths process efficiency, waste reduction, with the core principles of clinical risk management, which is laser-focused on identifying, analyzing, and mitigating specifically clinical risks.
Okay.
The idea here is that by tackling operational waste and inefficiencies with lean, you can indirectly improve clinical safety. For instance, giving staff more time to focus on direct patient care rather than getting bogged down by administrative burdens. And you do that while also using established CRM methods to directly target known clinical hazards.
So you're getting potentially a double benefit, boosting efficiency and tackling safety from the same coordinated effort. What about Lean Six Sigma? That's a combination many people have probably heard of.
Yes, Lean Six Sigma, or LSS, is a very prominent integrated approach highlighted in the literature review. It's quite popular. Lean, as we've said, focuses on speed, flow, eliminating waste. Six Sigma, on the other hand, is really focused on reducing variability and defects, often using rigorous statistical analysis.
Right.
So combining them, often using that DMAIC framework we mentioned, offers a pretty powerful system. It aims not only to improve efficiency, but also to drastically reduce the errors and process variations that are often sources of risk.
And is there solid evidence this combination works well in the healthcare setting?
The review points to quite a bit of research showing LSS being used successfully in areas like surgery, emergency departments, and medication safety. One review, specifically looking at LSS applications in surgery, found that something like 88% of the studies reported significant improvements. So yes, it seems to offer a systematic, data-driven way to tackle those complex safety and efficiency problems together.
Okay, wow. So we've really navigated the landscape of this research review now. We've touched on what lean is in healthcare, how this investigation was done, and these five major streams the studies fall into, from patient safety and employee safety through the absolutely crucial human element down to the specific tools used, and finally these integrated approaches. For you listening to this, maybe someone working in healthcare, maybe managing a team, or perhaps just interested in how these incredibly complex systems are trying to improve, what are the core takeaways? What should you really remember from this body of research?
Yet the review does a good job synthesizing the findings into several key contributions for understanding lean in healthcare risk management. First, it strongly confirms that improving patient safety isn't just about writing better clinical protocols. It fundamentally requires addressing the underlying organizational and process issues. Those human element factors we discussed, teamwork, training, leadership support, they are absolute non-negotiable foundations.
It's about fixing the system that the care providers work within.
Yes, precisely. Second, the research clearly demonstrates that lean can be effectively applied to address risks for both patients and the staff caring for them. Although it does note the research focus on employee safety still needs to catch up a bit.
Okay.
Third, and this came through again and again, it emphasizes that employee involvement, really bringing the insights and experiences of frontline staff into the improvement process, and strong, visible leadership support are absolutely critical. Critical for achieving meaningful and sustainable risk reduction. That culture change piece, while really challenging, is paramount.
So empower the staff, get leadership genuinely on board. Easier said than done, I'm sure, but essential.
Absolutely essential. And finally, the review highlights that these integrated approaches, like combining lean with clinical risk management or with Six Sigma, are showing real promise. They look like powerful strategies for tackling multiple goals: efficiency, quality, safety, all at the same time.
That gives a really clear picture of what the current research confirms is important in this field right now. But, science is always asking what next. Systematic reviews are great at showing where the knowledge is solid, but they also inevitably reveal where the gaps are, right? Where we don't have enough research yet. What were the big unanswered questions or opportunities for future work that this review identified?
Yeah, and this raises an important question. As you, the listener, think about maybe applying these ideas or even studying them further, where do you see the biggest potential or maybe the most challenging unknowns? The review definitely points to several areas where more research is needed to build a more complete picture.
What kind of things stand out as needing more attention?
Well, there's a noted lack of studies applying lean and risk management principles outside of the traditional hospital setting. Think about outpatient clinics, diagnostic labs, pharmacies, home health care.
Right. Most of the examples seemed hospital-based.
Exactly. And findings from large, complex hospitals might not directly translate or might need significant adaptation for these very different environments.
So how does this work in the broader healthcare ecosystem beyond just the hospital walls? That's a gap.
That's a big one. Also, as we touched on earlier, there's a significant need for more research specifically focused on employee safety outcomes. While it's recognized as important, there are fewer dedicated studies really showing the direct, measurable impact of lean interventions on staff well-being, injury prevention rates, burnout, things like that.
More direct focus on the caregivers themselves. Got it.
What else is a notable gap? A really interesting one they identified is the need for more research on concrete strategies for effectively overcoming doctor resistance to lean initiatives. The literature consistently flags it as a major barrier, but there seems to be limited research exploring how organizations can actually successfully navigate this specific challenge.
That feels incredibly practical and really important for anyone trying to implement this stuff in the real world.
It certainly does.
Yeah.
Another gap is the need for better, more standardized ways to actually measure the efficiency gains and, crucially, the sustainability of these lean-based risk management interventions over the long term. It's hard to prove lasting success if you can't consistently and reliably measure it years down the line.
Right. Understanding if the improvements actually stick and if they continue to provide value for the investment.
Yes. The review also found surprisingly insufficient research on the importance and the actual impact of patient involvement in lean-based risk management projects, despite this huge push towards patient-centered care everywhere else. There's not much study on how bringing the patient voice more directly into these process improvement and safety initiatives actually works or what difference it makes. That needs more exploration.
Interesting.
And finally, related to sustainability, there's just a general lack of longitudinal studies. Research that follows lean implementations over many years, not just 6 months or a year, to truly understand their long-term impacts, how they evolve, whether the benefits fade or grow.
So, do these benefits actually last? Do they adapt as the organization changes? Big questions.
They are. And just as a final point on future directions, the review also briefly mentions the potential role of emerging technologies, specifically mentioning AI tools, in supporting lean and risk management strategies. This is flagged as a future research area, noting that while it's exciting, it also introduces potential new complexities, ethical considerations like bias and algorithms that would need really careful study alongside any potential benefits.
So, using AI maybe to help spot risks hidden in data or optimize patient flows automatically, that definitely opens up a whole new territory with its own set of, well, risks and questions.
It certainly points to the evolving nature of this field, where established methods like lean might intersect with cutting-edge technology, creating both new challenges and new opportunities for managing risk effectively.
Okay. So, to bring this deep dive to a close, we've seen that lean thinking, this straw-shirt approach that was, born in manufacturing, is being seriously studied and applied in healthcare. And it's tackling fundamental challenges around cost, efficiency, and critically safety for both patients and the staff delivering care.
Yeah, the research, especially when synthesized like in this systematic review, really demonstrates that by focusing on improving processes, relentlessly reducing waste, and utilizing a specific set of tools, lean can achieve measurable, positive impacts on key safety outcomes. We're talking reducing falls, medication errors, even decreasing mortality rates in certain contexts.
And while the tools themselves are important, the research seems to overwhelmingly point to the human and organizational elements that teamwork, the training, the commitment from everyone, and especially that dedicated, visible leadership support as absolutely essential for making it work. It sounds like changing the culture and getting genuine buy-in are the deep, difficult, but totally necessary parts of making this journey successful.
They really are. Lean offers a framework for proactively identifying and mitigating risks, not just reacting. And this idea of integrating it with other approaches like Six Sigma or traditional clinical risk management seems to be showing real promise for tackling multiple objectives all at once.
So this deep dive hopefully has given you, our listener, a concise yet thorough understanding of where the research currently stands in this vital and evolving area. It really shows the potential power of structured improvement methods when they're applied thoughtfully in an environment as complex as healthcare.
And it also lays out those clear research gaps quite plainly, offering a kind of roadmap for where the field probably needs to focus its efforts next, to truly maximize the potential of lean for improving safety across the board.
So as you reflect on all this, maybe just consider this. Think about the immense untapped potential if healthcare organizations could truly cultivate a culture where every single person, from the environmental services staff right up to the top surgeons, feels genuinely empowered and equipped to identify and help eliminate sources of risk in their daily work. Imagine the transformative impact that level of collective engagement, driven by truly committed leadership, could have on safety system-wide.